Bed sores that develop at nursing homes are almost always preventable. When bed sores occur, it's usually because of a systemic failure at the facility where someone, or more likely, several someone, weren't doing their job. First, let's talk about what bed sores actually are. Medically, they're called decubitus ulcers. More commonly, you'll hear people call them pressure ulcers, or pressure sores, or pressure injuries. There's multiple names for the same thing. I typically refer to them as pressure sores because I think that's the best description of what causes them. But for today, we're just going to refer to them as bed sores because that's what most people outside the medical or legal industries call them. So simply put, bed sores developed when sustained pressure cuts off the blood flow supply to the skin and the underlying tissue. So think of it this way. If you sit in one position too long, you just naturally shift your weight because you start to feel uncomfortable. That's your body protecting itself. But elderly or immobilized nursing home residents can't always move on their own, and their skin is probably more fragile than yours. However, and this is crucial, bed sores don't just happen because someone is old. They happen because proper care protocols aren't being followed. A stage 1 bed sore looks kind of like a red area and it just doesn't go away when the pressure is removed. At this stage, it's completely reversible with proper and easy care. A stage 2 bed sore shows broken skin or shallow wounds, and these are still very treatable with immediate attention. A stage 3 bed sore is much more serious. Now, the wound is going deeper into the tissue, creating a crater-like wound. Now, at this point, there's no longer an easy fix. This has now become a serious problem. A stage 4 bed sore is the most severe. When a bed sore reaches stage 4, you can quite literally look into the bed sore wound and see bone, muscle, or tendons. These can be life-threatening and lead to sepsis or death. So here's the key point. It takes time for a bed sore to progress through these 4 stages. Stage 1 doesn't become stage 4 overnight. A properly staffed facility with attentive caregivers should catch and treat bed sores long before they become dangerous.